Good morning, everybody. This is Dr. Jamani here, and we're going to be talking about occlusal relationships today. This is part of the RDA EF2 program path at Ordemy. So what I want you to understand is that occlusal relationships is how do you determine the occlusion in the mouth? There are a lot of factors that are responsible for determining the occlusion. One part is the teeth and the jaws. Another part is the joint. So the joint that determines the occlusal relationship is called the temporomandibular joint. The temporomandibular joint, as you know, comprises of the mandible, right? Because it's a joint. So two things are meeting each other, the mandible and the maxilla. And in between the mandible and the maxilla, you have a cartilage. And I'm going to draw it out for you right here. So you can see this part is the maxilla. This part right here is the mandible. And in between here, you have the condylar cartilage, otherwise called as the articular disc. Now, the condyles, the position of the condyles, how somebody closes when they close their jaw. That's why when we did the intraoral exam, we checked for any fremitus, any popping, any deviations that the mandible is experiencing that is telling us that something is off with the condylar part. The most important thing is the condyles are usually located anteriorly and superiorly. And this part of the anatomy is called the glenoid fossa. It's sitting in a fossa called, fossa is nothing but an opening, called the glenoid fossa. It's otherwise called as the articular fossa, as you can see right here. Now, if there are any issues with the condyle and the translation of the path, then you're going to also see it in the bite. And sometimes people can't even open their mouth because of that. So now we're going to talk about something interesting. What is centric relation and what is the intercuspal position? So intercuspal position is nothing but centric occlusion. What does the word centric occlusion mean? The word occlusion is when the maxillary teeth and the mandibular teeth touch each other in this position. It's called as occlusion. The word occlusion means something is occluding or touching. So when you do this, your top and bottom teeth are touching each other, you're in centric occlusion. Now, there's another word called centric relation, which you need to understand. Centric relation is when you guide the patient's mandible and you ask them to put their tongue at the back. I ask them to close down. And you force the mandible into a backward position and the most superior position of the condyle. So literally you're doing this. Now, centric occlusion and centric relation can be different for different people. That's why your dentist would have told you that his bite is off. His bite is off. The word his bite is off means that the centric occlusion and the centric relation are not in the same dimension. So when a patient has a different centric occlusion and a different centric relation, or this happens a lot in ortho, when the patient bites down, you'll see their bite is different. So what I need you to understand is in intercuspal position, 40 to 60% of people in the population have their centric occlusion and centric relation being the same. Centric relation is a repeatable position. That means every time you ask the patient to do this, there's only that far that the condyle can go. So if you look at the picture over here, centric relation is the most posterior part of the condyle, where the condyle hits the upper bone. It can't go anywhere else. So this is a very important reference, especially when you're doing work, when you're making dentures, when you're making crowns, when you're doing full mouth reconstruction. You want to put the patient into the most repeatable, comfortable position that they can repeat over and over again. Problem happens when the dentist does not record this position correctly. Oftentimes, how do we record this position? You can record this position using the blue mousse. You ask the patient to bite down or wax wafers. These are approximate ways of measuring centric relation. A much better way is using a face bow, where you've seen some dentists have the setup where they take the face bow and they transfer the records into a fully adjustable articulator. And then they'll have the patient bite down into the most posterior position, and they'll transfer that bite into a modeling articulator that models the patient's jaw and joint. Now, that kind of dentistry, where the dentist really focuses on taking the correct bite and treating the patient to the correct centric relation, is the best kind of dentistry you can do. And it's worth its weight in gold. A lot of dentists today don't have the time to do that because we run busy practices. But that's the right way of doing things. Now, there was a man by the name of Edward Angle, who's also known as the father of orthodontics, who came up with something called the Angles classification. The Angles classification, he said, based on how your top and bottom teeth are biting and how your molars are biting and how your canines are meeting each other, the relationship between them, he classified the bite into class 1, class 2, and class 3. So that is solely just looking at the molar and the canine relationship. But there are many, many, many other ways of classifying the bite. I'm just going to talk to you about Angles classification here. Now let's look at Angles classification. This is a favorite question that comes on the board. They'll show you a picture like this and they'll ask you, is this class 1, is this class 2, is this class 3? The most important thing in class 1 I need you to note right here is that the mesiobuccal cusp, this cusp right here of the upper maxillary molar, is sitting in the lower mandibular groove. So the mesiobuccal cusp of the maxillary first molar aligns with the buccal groove of the mandibular first molar. And the canine, as you can see, the relationship of the canine, the upper canine is sitting in between the lower canine and the premolar right here in this fashion. When you have a bite like this, your overjet and overbite is going to be ideal, which is nothing but 2 millimeters overbite and 2 millimeters overjet. And I'm going to talk to you about what exactly that is in the next slide. So this is a very common board question. They might show you a picture and they might ask you, the mesiobuccal cusp of the maxillary first molar aligns with the buccal groove, true or false? And you need to say that is true for angle class 1. What is angle class 2? The mesiobuccal cusp of the maxillary first molar is mesial to the buccal groove. So this is not sitting in this anymore. If you imagine the whole upper arch being shifted forward this way, what is going to happen? The mesiobuccal cusp of the upper maxillary molar is now mesial to the lower mandibular groove. So the mesiobuccal cusp of the maxillary first molar aligns to the mesial to the buccal groove of the mandibular first molar. So imagine the entire upper segment got shifted forward. So in cases like this, you're also going to see the canine is going to be end on with the lower canine, or you can also have the canine forward or mesial to the lower canine. Now, in this kind of a bite, the patient is going to come in and tell you, I have a buck, or they're going to tell you that I have a big overbite. The patient uses the word, I have an overbite, or they'll tell you that I have buck teeth. So that is a sign of class 2 occlusion. Now, class 2 occlusion, there are two types. There's div 1 and div 2. The word div 1 means the upper teeth are flared out like this compared to the lower teeth. The word div 2 means the upper teeth are flared out, but it's like this. You'll see the patient's teeth more inwards. So these are the lower teeth. This is the upper in class 2 div 1. In class 2 div 2, you'll see the teeth going this way. But it's still out, but it's just the angle of the teeth comes this way. Why does that happen? Because the body compensates. It basically protects the teeth from getting broken, especially when the child is playing. So the upper lip starts to push the teeth in as a compensatory mechanism. Okay, let's move to the next slide. So angles class 3. Angles class 3, what is it? It's nothing but a bulldog bite or a negative overbite. So let's look at that. The mesiobuccal cusp of the maxillary first molar, that's this cusp right here, is distal to the mesiobuccal groove. So imagine the whole upper arch got shifted this way. So the groove now, this mesiobuccal cusp is sitting behind the lower mandibular groove. So what happens if you push the upper segment this way? You're going to see a negative overbite or a doggy bite. Now, you don't want to look at a patient and tell them, hey, you have a doggy bite, because that is not correct. But I'm just giving you ways of remembering when you look at a picture like this in the exam and you look at a bulldog bite like this, you immediately know that it's class 3. All right. And what you also need to know is that the canine relationship, the lower canine is way pushed forward, okay, compared to the upper canine. So also you're going to see that this kind of patient is going to have a negative overjet of -4. This person, if you measure from here to here, is going to be -3 to -4 in that range. So this kind of negative overjet is called class 3 relationship. So I need you to register this picture in your brain. This is what class 3 looks like. Now, what is happening in the front? As I said, imagine the upper jaw moving forward and backward, but what is happening with the front teeth? The front teeth, basically a correct relationship or a class 1 is this, where your upper teeth and your lower teeth are in a good relationship with each other. What does that mean? Your lower incisal edge is sitting at the back of your upper incisal edge in that little notch right there that the upper incisor has for it, right? It's called the cingulum plateau. If you put your finger behind and you feel that little notch, it's called the cingulum plateau. So this is a good relationship, and this is what we want to achieve. But a class 2 division 1, like I told you, it's buck. The teeth are sitting out. So this is called a buck relationship, or the teeth, you know, the patient's mom is going to say, oh, there are other kids making fun of my kid in class. They're calling my kid Bugs Bunny, and, you know, I really want to correct the overbite. So this is a traditional class 2 div 1. As I told you, in a class 2 div 2, the body compensates and the lip basically tries and pushes the upper teeth in to give you this kind of a relationship where the upper teeth are pushed in. It's class 2 div 2. And class 3, like I told you, is a doggy bite or a bulldog bite or a reverse bite. And that's what you're seeing over here, where it's a negative overjet. All right. So now we're talking about anterior tooth relationships, right? I said we want to measure the distance between the upper teeth and the lower teeth. What are we actually measuring? We're measuring the horizontal overlap between the lower teeth and the upper teeth. And from which point are you measuring that overlap? This overlap is being measured by the facial surface. So if you look at the facial surface of the lower incisor and the lingual surface of the upper incisor, you want to measure the gap between these two. And how do you do that? You can use a small ruler, you can use a periodontal probe. So if you're using a periodontal probe, it's easy. You just go this way, you measure it, you write it down. Now, if you can see, this particular person here has about 4 millimeters of horizontal overlap on this periodontal probe, and that is how you measure it. It's about 3.5 to 4. You can say, yeah, this is coming up right here. It's about 4 millimeters. Now, overbite is nothing but the vertical overlap. How much is the upper tooth overlapping the bottom tooth? So in this case, this is how much it's overlapping. And how do you measure that? You want to stick a probe vertically inside and you want to measure that. So in this case, over here, you want to measure it from here to here. So that's approximately 3 millimeters. So that is called overbite. It's the vertical overlap. Patients oftentimes, they don't know the difference between an overbite and an overjet. They call everything an overbite. My daughter has an overbite. What do they mean by that? They mean the teeth are sticking out. So you need to know the difference between overbite and overjet. Overbite is the vertical relationship and overjet is the horizontal overlap relationship. So if I show you this picture in the board exam, you need to be able to identify which is overbite and which is overjet. Okay, next topic. Now we spoke about a vertical overlap, but there's another malocclusion. The word malocclusion means something wrong with the occlusion. Mal is when something is off or something is out of proportion or it's non-functional. So malocclusion is when something is off with the occlusion. One of the things that we discussed was an overbite, right? We spoke about an overbite. What happens if the overbite doesn't exist and it's open? That's called an open bite. So why does that open bite occur? So open bites can be both dental and skeletal. A dental overbite is more the problem with the teeth. Maybe the child had an accident in a playground and the teeth didn't come down all the way. It just stopped halfway. And that can be, maybe in this picture right here, the teeth didn't erupt all the way. That can be a dental overbite. It could be a tongue thrust problem where the patient, as you can see, is sticking their tongue in that hole. That also causes a dental overbite. Or sometimes there's a problem with the patient's jaw itself, where the upper and lower jaws are not touching each other, like you can see here. This, my friend, is a skeletal overbite. What does that mean? Even if I remove the dental problem, which could be the tongue, it could be the eruption problem, this is not going to close because the jaw itself is open this way. So if you take a cephalometric x-ray of their skull, you'll see the upper jaw is open this way and the lower jaw is open this way. So this is a surgical problem that cannot be corrected that easily. Now this picture right here, behind right here is also a patient is sticking their tongue in that hole, and that's what is causing the open bite.